On today's episode,
It's very hard to take care of a person dealing with SIBO when you have an existing mold exposure that's constantly happening. Here's the reason why. The issue is that there's a colonization of the mold spores happening within the sinus cavity. And that in itself can be passed on from the sinus down to the esophageal into the gut itself. Where would this mold spore end up having to colonize? Inside your gut. Why? It's dark, it's wet, and it's heated.
Hello and welcome back to the Vibrant Wellness Podcast. I'm your host, Dr. Emmy Brown, here with my fantastic co-host, Melissa Gentile. Today we have Dr. John Kim. He is a highly regarded functional medicine pharmacist and a leading voice in health, wellness, and preventive medicine. Graduating with high honors from the Ernest Mayo School of Pharmacy at Rutgers University, Dr. Kim's academic journey propelled him to pursue advanced training in functional medicine through the American Academy of Anti-Aging Medicine, earning him the distinguished designation of Full Fellow in Anti-Aging and Regenerative Functional Medicine. Driven by a health journey that we are sure to talk about today, Dr. Kim is dedicated to uncovering the root causes of chronic illnesses. Today, he helps clients navigate their health via his virtual tele-wellness practice, Dr. Kim Wellness, providing holistic healthcare solutions to optimize hormonal balance, address immune system dysfunction, and restore gut health. John is a staunch advocate for medical freedom, championing individuals' right to make informed decisions about healthcare. His core message is the doctor of the future is you, the patient, which I just think is brilliant. So get ready to be inspired by Dr. Kim's expertise and passion for holistic health. John, thank you so much for being here. We're so excited to have this conversation with you.
Emmy, it's an honor. And Melissa, thank you so much for your invite. I'm excited about this opportunity and talking deeper about the root cause issues, some testing, especially mold toxicity that I'm so passionate about. So yeah, I'm just very excited to be here.
Yes, we're going to get into all of that and more. So I want to kick it off with your health journey. Quite a shocking and compelling story here, John. You had a widowmaker heart attack at age 33. Can you tell us more about that harrowing experience?
Yeah, I would have never expected to be having a heart attack when I was 33 years old, but happy to be the case back in 2015. I just came back from my friend's wedding, and 4 days later, I was just having this severe heartburn, which I thought was a heartburn. Instead, I was walking around with a chest pain for 48 hours. And finally, the chest pain ended up having to radiate down to my left arm, finally realizing what was going on. But instead of going to the ER, went to the urgent care center to get myself EKG done. And the urgent care center doctor just came in frantically into the room, and he ended up having to send me out into the ER, getting transported. And even when I was in the ER, the doctors, including cardiologists, did not really believe that I was having a heart attack because I never actually had any classical heart attack symptoms, especially shortness of breath, sweating, or anything of that nature, except for chest pain.
Sure.
So they were suspecting I was having pericarditis, which can be common, right, from viral infections for young men like myself. And after going through echocardiogram, my left ventricle wasn't pumping correctly. And that's when they were suspecting ischemia. That's when they decided to put me into the cath lab. And lo and behold, I had 85% blockage. So they had no choice but to stent me at that point. And after getting that done, being in the cardiac ICU unit for 4 days, still having lingering chest achiness, that overall pain was not disappearing except for causing additional anxiety. And I have to go through another cath, wondering what had happened. And then the biggest question is, how can I prevent this from happening? So after getting out of the hospital, sitting in my living room for 7 days, just staring at a wall, constantly thinking about what I should do for the next step, I decided to reach out to my functional medicine provider to see if there's any way that I could do just simple IV drip of vitamin C or something on that line, just to help my energy to recover and then potentially ask additional questions. And her main question when I saw her was, are you dealing with some type of tick-borne related illness? My answer was, no, I never had any bullseye. And now we understand that bullseye is not a requirement for Lyme disease or anything of that nature. So after getting the blood drawn done, testing wise, 4 weeks later, that's when I tested positive for Bartonella infection. High levels of mycotoxins, especially I had high levels of antibodies to Aspergillus, Epstein-Barr, mycoplasma, and that was the start of everything. Just wondering what had happened, how could I have prevented this, right? Many questions unanswered, but I had to go through it. 2 years of really hardship of certain days that I couldn't even get out of bed because I was sick so badly from the overall treatment I was going through, on top of now really diving into what these biotoxin issues are and how it can impact every person I'm dealing with, including myself. And that's really the pinnacle and the start of how what I do now has started from that point on.
So you were really loaded up with toxins and infections. I mean, you had a lot going on there. And I do have to ask real quick. You mentioned that you went back to your functional medicine provider kind of after this experience. Were you working with a functional medicine provider prior to this heart attack, or was this kind of like your first time stepping into it?
This was the first time stepping into it because I have a compounding pharmacy that I also manage. I
Mhm.
have a lot of connections to functional medicine providers all around New Jersey, New York area, but I've never actually questioned in terms of my overall health. But there were a lot of questionable things that was happening in my health, especially I was dealing with chronic food sensitivity issues,
Mhm.
especially to beef and dealing with any fiber. I was started to getting bloated on top of having bad breath, constantly dealing with cystic acne all over my face. You get to see what was going on already, but even having a background and knowing a lot of the root cause issues, you never end up having to pinpoint your own issues and reflecting upon it. And I think this is the wake up moment for a lot of functional providers and even doctors in general, providers in general, because we're so busy helping our clients, except for we forget to really observe our overall health and that we need to take care of our own issues even before we start to work with our clients. And that's the one thing that was just an eye-opening moment that I need to take care of my health better.
Mhm.
And yeah, it took me 2 years, but looking back, that was such a blessing.
And thinking about this, what I think is so interesting, and I think what are like something I really want to express to the listeners is that you can have mold exposure, toxin exposure, chronic infections, but every single person is really a different case, and every single person is going to get kind of different symptoms. You know, the symptoms that you experience and what you had is going to be very different from the next person, even if they're exposed to a lot of the same things that you were exposed to. So what causes people to have different reactions to kind of the same toxins? And what I really think about is, especially when it comes to mold, is like how can you have multiple people living in the same moldy home or moldy work environment, but one person reacts and one person doesn't?
That's a loaded question because depending on the person's scenario of how well they're able to detox mold out, as well as what type of immune related reactions that come through, and especially when you're talking about patients having certain genotype issues, also, especially if you actually have a HLA genotype, you're not likely to be able to detox mycotoxins correctly. As a result, there's a constant issue dealing with cytokine response, then having activation of certain different markers, especially interleukin 1, and then you're dealing with the fact that there's a high levels of MMP9 that could be elevated. You could tell this from doing basic functional lab testing, but then now you're adding an additional inflammatory condition. So now you have a cyclical inflammatory response. So there's that whole word called SIRS, which is called chronic inflammatory response syndrome. It's just a cluster of symptoms followed by cyclic of inflammatory conditions and then leading into immune and hormonal dysregulation that comes through, and then followed by leaky gut, having overgrowth of mold actually happening in the gut itself, and then you're not able to optimally detox because your gallbladder might be quote unquote stuck, or you're not having enough enzymes in the liver to handle a lot of the stressors from the mold in itself. And this is where the difference from one patient to the other, or having to see a husband not reacting at all, and then the wife is having severe issues dealing with mold and cannot get rid of it. And then you're talking about, on top of co-infections like Lyme disease, right? There's main questions like, which came first? Did the Lyme or the mold? Did the mold end up causing more likely issue with Lyme, or the Lyme causing more impact until the Lyme come into picture? So that could be another impact, followed by patient's history. Maybe they have a trauma, emotional trauma, physical trauma that occurred. I see a lot of clients dealing with head trauma because they were past equestrians. They fell off their horse, and then exposure to a wet building leading into mycotoxin exposure, having cyclical issues of leaky gut followed by leaky brain, having a lot of neurological symptoms that comes through. So it's very much of a loaded question because it really depends on the person's history, their past exposures, their past experiences, epigenetic aspect that we have to talk about. They may actually have a severity of a fatty acid deficiency because of the poor diet, or is just the overall diet aspect of high levels of inflammatory oil getting involved. Toxin exposure, especially heavy metals, pesticides, especially glyphosate, could be a big impact. And then another thing that I'd like to talk about later on is about how certain toxins end up having to be embedded into the DNA. So there's a whole word called DNA adduct, where it should change the expression of the DNA and your genetic makeup. And that's what epigenetic is, essentially having to produce different expression within the organs and then within the systems of your body. So some of the examples I give a lot is how the vitamin D receptors end up having to downgrade because of the mycotoxin exposure, right? And then having to have a poor vitamin D levels coming through. Conversion issues is another thing. Thyroid aspect of it as well, where person's thyroid end up having to be abnormal or not converting optimally. So that could be another issue. And then also their gut function leading into leaky gut and having to not able to fix their gut issue until you really hone in on the mycotoxin issues and mold toxicity. And then you're able to get this person cleared into having an optimal GI function. So it's not a simple answer to say. I think there's multiple factors. One thing that I am always humbled based on the clients that I work with and then more I learn about is that we as a functional medicine providers are still sectioning off patients based on their systems within the body. One functional medicine provider would be like saying, I'm a GI specialist. One person says, I'm a immune specialist or hormonal. But if you think about everything else, it's all encompassing in terms of GI, immune, and as well as hormonal dysregulation, and all stems the fact that there is a major player of biotoxins, environmental toxins, nutraceutical deficiencies, followed by nervous system dysregulation and GI abnormalities, leading into all those three main hierarchical problems that we're still trying to section off. That I want to encourage every functional medicine provider, I don't care if they are a doctor or nutritional therapist, you want to look at everything and really get to the root of the issue instead of just hyper-focus on one thing, because those are the patients that I see where they have GI issues. They go to a GI functional provider and they haven't addressed anything related to mold toxicity, right? So that's the biggest things that I end up having to uncover. And then when you're having to see these patients having chronic issues and having to deal with fatty acid deficiency, cell membrane damages, and mitochondrial dysfunction, there's a step towards to unraveling that very carefully, right? So there's a whole topic of cell danger response that we forget to look at these things, and we just keep on having to add in additional supplements, especially glutathione. A lot of patients cannot tolerate glutathione, and the early onset of mold toxicity, and then trying to crank the methylation process because, their methylation is a process so low, and giving activated B vitamins, it's just going to make them matters worse.
Too much.
So there's too much of everything else.
Yeah.
And so There's certainly good ways of handling it, but as a practitioner, it's all about how you orchestrate the healing process and looking at it and really respecting the role of how what the body's doing, and especially the role of the mitochondria.
All right, John. So this is very complex. You've mentioned a few things we've talked on this podcast about before, but a couple brand new things. And really what I'm hearing is it doesn't necessarily matter what's coming first, whether it's chronic infections like Lyme, Bartonella, mold, all of these things are at play. But you did mention addressing mycotoxin illness before cleaning up the gut. Is that right? Did I hear you right?
Correct. Well, there's two ways of doing it right now. So if you actually have a person who's actually living in a very moldy environment, the issue of, just give you an example of patients dealing with SIBO, it's very hard to actually take care of the person dealing with SIBO when you have an existing mold exposure that's constantly happening. Here's the reason why. The issue is that there's a colonization of the mold spores happening within the sinus cavity, and that in itself can be passed on from the sinus down to the esophageal into the gut itself. Where would this mold spore end up having to colonize? Inside your gut. Why? It's dark, it's wet, and it's heated. Perfect environment for mold to actually grow. So there are other advanced stool testing out there. I cannot say names because right now it's under investigation aspect of it, but I've looked into this, where it actually pinpoints the overall imbalance of candida overgrowth in the gut in itself. So when you see that happening, and when you're seeing the fact that these patients are actually overloaded with mold inside the gut, herbal therapy may not work very well. In a scenario like this, use of pharmaceutical itraconazole will be a great way. I would recommend doing around 100 to 200 milligrams twice a day for about 14 days. That would help to really reset the mold burden inside the gut and start to recolonize. So I just did one recently for myself, and I was surprised that I actually had 100% Saccharomyces colonizing and 0 mycotoxins. So that really shows the things that I've done for myself over the years, and what I do on a daily basis really helps to get the mold issue under check. And that actually helps to give me a better footing of how do I take care of myself, as well as hopefully preventatively dealing with all the other issues that could come into play. So whenever you actually have a questionable patient where everything else you worked on and nothing seems to work, the main question is there mycotoxin / mold getting involved? And so doing a total tox burden testing is a must at that point in time.
I do have to ask, because you did mention the colonization of the mold spores in the nasal cavity, and then getting into the GI tract kind of from there. So would this be the type of scenario where it has to be environmental mold and not dietary mold? Like, what's kind of the difference there? Because when you think of mold exposure, I mean, a lot of the general, public is going to think of like black mold that they see in their house or see in an office building and see in their environment. But what about like grains, nuts, mushrooms, like the molds that we're actually eating?
It's everywhere.
Yeah, it's everywhere, especially when you talk about aflatoxins and ochratoxins. Those are very much embedded within the grain, the rice, and such. So if you actually have a patient who's dealing with a mold scenario like this, I would actually have them completely cut those out, including oxalates. So that's the number one thing that I do. And so some of the things that I really implement right away is to change the diet into a mitochondrial supporting diet. So really impacting on the levels of animal protein around 30 to 40, almost 50 grams per meal, on top of minimizing carbohydrate intake down to 20 grams. Because if you end up having to have a sugar, at least the insulin spike that's constantly happening, that in itself can be impacting the cell membrane as well. So really honing on and fixing that, and as well as anything that might be offending the body, especially oxalates, can be a big impact on the mold toxicity. So I try to get rid of oxalates right away. Now, this can be upsetting to a lot of vegans, right? And people who are really into eating vegetables. It's okay. The thing is, like, how can we work together to really reducing the oxalate exposure? Because there's oxalates everywhere, including avocado has oxalates. But if you can minimize the oxalate exposure, that's wonderful. But there are certain patients who have really bad oxalate sensitivity. I've seen a case where there were crystallization of the skin because the oxalate crystals start to come out of the skin itself.
Oh, wow.
Right? That's a beyond the scope that what I could do. I'll be just handing that case over to another physician that could do
Same here,
IVs.
Brown.
But in that scenario, I'm just like, that's scary as anything. I rather not handle that case. So that's a severe scenario in terms of how oxalate come into play. Oxalates can cause a lot of issues into your joints getting really stiff and then have to deal with additional GI issues. So these are things that I really pinpoint and navigate the patients through. But going back to the colonization of it, yes, that is more of an environmental exposure where it's not just about the black mold. If there's any exposure dealing with wet building, especially there's a sheetrock being wet and then there's a particular warping of the wall, that's mold. It doesn't have to be black. It could be yellow, but it could be certain spots. And we're not even really looking at the moisture getting involved either, because that becomes a perfect environment for mold to grow. So if there's any suspect of that, first thing that I put the patient on is doing some type of nasal irrigation to get the mold spore and issues of endotoxins getting reduced. So say any symptoms dealing with MARCON, for instance, or having to deal with overcolonization of the mold in the gut can be reduced from that point on. But one thing that we do have to tell a patient is that just because you're doing irrigation of this nature and controlling that, if you're still living in a moldy environment, it's not going to fix the problem. And there's the same discussion I was just having with one of my clients. After 5 months, we were able to really reduce the mold toxins down to a little bit of issue dealing with aflo, and then he has a small issue dealing with citrulline. But compared to what it used to be 5 months ago, not in a difference, but he still actually has an ongoing issue with mold colonizing in his house. I believe it was in the HVAC unit that's still not been resolved yet.
Mm-hmm.
So even though we did a lot of work, it's a matter of time that in itself, if you don't keep up with the supplementation and lifestyle aspect that he has to do, those mold issues are still going to come back. Why? Because you still haven't taken the source where you're getting exposed to.
Right. And I want to talk about this at some point, John. We might as well just talk about it now. And how do we find reputable home testing companies for mold and remediation? Because I think that it's generally, word of mouth. Where do we start with testing? What can we trust? What kind of results can we trust? And do you see that these home test results correlate with laboratory evidence?
Well, let's take the first question. So
Sure.
Who do we trust? Who's the reputable people to work with? I certainly respect Michael Rubino greatly, especially for the mold finder. And so I'm sorry, mold medic, excuse me. The mold finder is another page. But Michael Rubino actually has a at-home test that I end up having to utilize. It's called the dust test. Very simple. It's about $550. And it's very comprehensive and it's very sensitive test to check for dust particles, especially surface sedimentation of mold on the surface. So I prefer, if any patient has issue affording a good testing company, and the definition of good testing company could vary from left and right, but if you want to do a quick at-home testing, that could be one good way in ways to do it on your own. And especially for mold remediation, is after the test results come back, this is something that, and I really hate seeing all the time, is that the testing company end up having to provide the remediation at the same time. That's a conflict of interest. That's in certain states, that's illegal to do. So you do have to find the right mediation company and really see what their trainings are, what type of protective barriers that they create. Are they using any negative pressure vacuum before they're doing remediation? Is there any other modalities that you use? So these are the important things that you have to investigate and find a reputable remediation company. Because when I actually had an HVAC matter in my building, for instance, it was very difficult to find a reputable company, especially within the New Jersey, New York area, because even though they might market us as a mold remediation company, they were not doing things correctly, right? They did not provide protective suits for their employees or masking. And
That's a
then on
red flag.
top of, is a red flag. And then on top of, when you talk about certain cleansing agents, there's certain toxic cleansing agent they end up having to use, which can release more volatile gases inside the home. And that could affect a person who's very sensitive. And then when you're dealing with SIRS, it's going to make the matters even worse. And in that, you have to ask what kind of cleansing agent that you use. So it's not a simple question, except for if you're going to be walking to work on your issue with mold toxicity, the practitioner should be knowledgeable enough as well to give you these pinpointers and working through this process. So whenever I work with a mold clients, especially during a 6-month process, the first thing that we teach them is find the right testing company, and as well as how to navigate and then investigate which right remediation company as well to handle this, and then walk through the process of it. And so it can be very costly. It can be very stressful, but that is a must that you need to do. And then the second question was, if you could repeat, what was the second question?
Sure.
Sorry.
Home testing results correlating with laboratory evidence per
Yes,
individual.
It does. So ways to really look at it is you want to get the home testing first, or at least you could do the urine mycotoxin first, and then compare back and forth. And usually is about 90% correlation in terms of what you see environmentally versus what you see in your body. So, and as well as there's certain cases where the patients are not able to excrete the mycotoxin very well either, right? If the person's issue dealing with the fact that they've had a chronic exposure to mold, when you're doing mycotoxin testing, the mycotoxin level might be very low in their body coming out versus what you see at home. So the biggest question is it right at that point in time to retest it, or do we empirically treat the patient based on what we find by the environmental testing? The answer is yes. And then the second matter is, does it require us to start doing provoked urine testing? Because, for instance, Dr. Neil Nathan, I respect him a lot as well. I see him as a mentor. He actually recommends doing glutathione 500 milligrams twice a day for 7 days before doing actual urine mycotoxin testing to actually provoke it. But there are certain practitioners who are actually now utilizing sodium butyrate orally or as an IV, sodium phenylbutyrate, because butyrate's actually able to cleave off the DNA adduct of the DNA, and you could see the level of change of mycotoxin in the urine. And so use of sodium butyrate can be very helpful to see how much of the actual mold is within the cells and excrete that out into urine itself. So you could see a very degree of mycotoxins in the urine after utilizing different modalities of provoked urine. And then there are certain cases where if you work with a client for about a month or 2 or even 3 months and retesting the mold results can be higher compared to what it initial test results was.
Gosh, yeah, there's so much. And I love that you brought up, John, the provoking question, because oftentimes we suspect mold illness, test comes back, and things are lower than we were expecting. You know, they're not excreting as we would expect, because for our listeners, as a reminder, we're looking at urine mycotoxins oftentimes. So provoking, that's something that, you know, I'm thinking about getting baseline, but then you may want to provoke. So that's super helpful. Thank you for going over that. I'm wondering, do you ever just jump into doing a baseline and a provoked urine sample at the same time for a patient if you suspect that they're not excreting or detoxifying very well?
So that's really depends on the person. So especially if I suspect the person who's dealing with a gliotoxin, and good ways to ask questions is, are you sensitive to any sulfur-containing food, especially garlic, onions? If they are, then I suspect as being gliotoxin. In that scenario, I cannot use butyrate or doing glutathione, because they can end up having to have mass amount of reactions from taking those two things. It's not the butyrate having sulfur issues, but butyrate end up having to increase the excretion. And so those patients who don't have a right drainage support, they can end up reacting even more. So in a scenario like that, then I'll say, no, just do a straight urine testing. Let's see what kind of results we come back. But very unlikely end up having to see any traces of urine mycotoxin at all. You do see it. You may end up having to have a varying degree between the environmental versus what you see on the test results, but you still have to treat the patient based on the symptoms that you see and the suspected mycotoxins.
It's really not black and white. It's really
It never is.
Yeah, it really never is when it comes to our field of practice here. John, I can't stop thinking about the comment you made earlier about the epigenetic effects of mold exposure and toxicity, and how you were saying how it actually changes the expression of DNA. I want to unpack that.
So let's give you some examples of how certain mycotoxins end up having to cause this. So good example is trichothecenes, which is basically black mold. It has been shown based on all the studies that is seen right now, and especially these type of studies are not done in humans, right? Why? Because it will be unethical to do mold toxicity testing in humans. So the general studies you end up having to see is animal studies, right? That you have to extrapolate into how these are going to be affecting the human body. So trichothecenes, for instance, actually can cause a DNA and RNA and protein synthesis to be affected, which is leading into further inflammation, right? We know that inflammatory conditions leading into changes within the cell function and the cell membrane, right? So that's something that we have to teach our clients about, followed by trichothecenes can also cause damage to the actual blood vessels. In certain scenarios, I've seen cases where it can cause clotting and bleeding issues, leading into exposure to trichothecenes. Immunosuppression, right? So how does the immunosuppression end up having to cause, and what is that related to the changes in epigenetics? That's the thing. Your immune system has to be robust enough to handle the overall stress, but the mold toxins end up having to cause the immunosuppression issues. Why? It's affecting the cell function, and in itself is changing how the cell expression is happening there. So that's something that we have to look at as well. Vision changes can occur. GI issues I mentioned about before, impacting all cells, and then leading into also, in a severe scenario, be lymphoid necrosis could be another thing. I mean, that's a more severe scenario, but that's that. DNA changes can lead into cancer as well. So gliotoxin has been linked to certain cancers, especially causing lung cancers or lung damages, autoimmune disorders, and then leading into immune dysfunction. So you do end up seeing autoimmune issues where patients end up having to have rheumatoid arthritis, or at least a rheumatoid arthritis-like symptoms that I've seen. And then other mold toxins like aflatoxin, which is very common, they have shown to bind to DNA and affecting protein structure as well, and attacks the liver, such as potentially causing hepatitis issues, or non-fatty hepatitis issue can be occurring, as well as lung cancer as well. And then Ray's syndrome, where they actually have poor circulation, and then malnutrition. So, and we've seen this, and there's certainly one human study that I've seen. It was a review article where it saw that kids who are exposed to mold toxins, they have poor ways of thriving within their growth, especially looking at the malnutrition and how that is overall linked to stunting of growth in children. That can actually occur. So mold in itself can be impacting multiple ways into a child, into an adulthood, including pets, right? So you have to look at multifaceted in that scenario. So one thing that I do encourage every young patient to do, if they can, they could afford to do it, run a total tox burden testing, right? Get your GI issues squared away, including your hormones, before you start to even think about having family. Because the overall DNA changes and the DNA adduct you end up having to have and the mitochondrial damage occur, you pass the mitochondrial damage to your child.
And is this reversible? Like if someone can catch it, mold toxicity on a test, or some of these things reversible, or some of them more permanent? Can it kind of change back?
Absolutely. It can change. So there are companies like IGL. IGL is a German epigenetic testing that you could see what type of embedding of these toxins getting involved in the DNA. So I've seen results where I've done it for myself as well, where I actually had an overexposure to fumonisin and aflatoxin, and then 3 months later, in terms of the overall lipid treatment versus plus antifungals, end up having to reverse the actual DNA adduct. We see this in the blood tests, right? So there's a huge misunderstanding that we cannot reverse it. No, it is reversible as long as you're able to get the DNA adduct damage fixed and then allowing the proper function of the cell membrane to occur. But we, as a practitioner, when we jump into doing mold treatment or any type of mold issues, the first thing we end up having to do is giving antifungals. There's place and time doing antifungals. However, if you think about how the cell membrane and how the cell's functioning in the early on stage of cell danger response is that the entirety of the cell membrane gets completely locked. And there's a poor communication between cell to cell, and there's a poor in and out of these different toxins within the cell, because what this mitochondria in the cells try to do is to contain that particular damage within the cell in itself. So when you have a poor functioning cell membrane and trying to detox mold, including heavy metals, if you don't address the actual cell membrane damage early on, you're not going to be able to fix the problem permanently. You're just going to catch up on the symptoms and try to wonder. In many cases, patients end up having to wonder, why am I not getting any better, except for why am I getting worse based on the therapies that my practitioner is giving me? Because you still have not addressed the cell membrane damage and the lack of the proper fatty acid replacement that the patient actually needs. And this is the reason why I love utilizing Body Bio PC, their balanced oil, because the proper structuring of the omega-6 and omega-3, the sodium butyrate, and especially TUDCA. TUDCA not only end up having to help with the gallbladder and fat absorption, but TUDCA actually helps to mend the protein misfolding that goes on from the toxin exposure. So the way that I explain my clients about cell membrane, or at least the cellular detox, is this. You utilize butyrate to help cleave off the mold toxins off the cell membrane. TUDCA comes in to mend that particular protein misfolding that's happening within the DNA itself. The PC, the phospholipids, come in to sweep off the actual toxins away. And then you actually have proper supplementation of the phospholipids and then the alpha-linoleic acid and linoleic to help properly mend the cell membrane. So this way the cells are able to function properly. So this way you actually have a cellular detox that's going to form well as in order for antifungals or any type of these medications going to work well, you need to have a proper functioning cell membrane to begin with. So you're not fixing anything except for just following the symptoms and the troubleshooting the problem. And then the patient at the end will be wondering, why are they getting worse before they get better?
There's so much to that, John, and you keep taking us back to root. And I love that, because it's really, so even before mold, as we said, we need to prioritize cellular health and cell membrane health. And I've never heard addressing cell membrane health described in such detail. So thank you for that. That's extremely helpful.
You're
giving us so many practical tips.
And I also run a Kennedy-Krieger fatty acid analysis as well, because that in itself shows us the level of damages when the cells, but also deficiency in the cell membrane, especially oleic acid. You can't test that on its own, except for this particular testing modality. Even the best part is you could tell the fluidity level of the cell membrane and how imbalance between omega-6 and omega-3 is going to cause the fluidity index of the cell membrane to change. right? So that in itself can be very impactful of what type of food the person needs to eat as well. Certain cases, if the person is very low in stearic acid, I actually had them increase their intake of animal protein, but especially liver and animal organ supplementation. Right? Why? Because they're lacking in those nutrients, right? It's densely nutrient. And it's very difficult when you're trying to work with a person who's completely vegan and trying to supplement those. You can supplement it using certain plant oils like black cumin seed oil, pumpkin seed, or including sesame seed. But it's so hard to replace those fatty acid when you are trying to do that with animal protein.
Right.
Or especially animal fat.
I do have a question about this. So is this cell membrane damage, is this unrelated to mold? This is something that happens from nutrient deficiencies, or is it something that like when the mold comes in, it causes damage to the membrane of the cell?
Absolutely. So mold can actually cause this type of damage than anything. The issue behind is that I actually did a recent mold webinar explaining about this to my patients, is that mold in itself not only end up having to cause damage of how certain nutrients getting, I mentioned about how certain protein and fats being absorbed is the biggest thing that we see. The biggest thing that I also see is the fact that some of these patients are not able to allow proper management of the cell membrane structure to form. So there's one. So that there's a major deficiency that goes on, as well as how certain fats, especially cholesterol, is formed and is being produced, as well as how certain cell turnover actually occurs as well. So the whole word called autophagy or mitophagy is very important of how cell function is functioning. But when you actually have a damaged cell membrane and the formation of proper cells to occur, you're just going to be having a improper formation of the cell membrane constantly happening. And then the cell in itself is just completely in a dysfunctional state. And this is where the whole term called mitochondrial dysfunction comes in. The mitochondria in a dysfunctional state is because it's sensing a danger, but also the fact that their membrane is completely damaged. So in order to have a proper mitochondrial function is by replacing these necessary fatty acids so this way it could work properly.
I'm wondering, John, what are you doing prophylactively or preventatively when maybe you see a healthy, vital teenager going off to college? Their dorm will most likely be moldy if it's an old building. Are you running some of these tests preventively?
Wow, that's a good question. I mean, I don't think anybody is aware of what the mold issues can do, right? And so it's a very difficult to answer to ask unless the person's having symptoms. Right. They're not going to sneak out for these. And it's going to be a hard sell for parents to even thinking about this when they think that their kids are healthy, right?
Sure.
But if you have symptoms of ADD issues, gut problem, right? So focal point is that there's some issue going on that you should probably look into it, but how much are you planning on unraveling is number one. Number two is, do you have the capacity to handle this right now?
Yeah.
Trying to talk to a college student about lifestyle changes and dietary aspect of it is impossible, right?
Right.
Or
just take an adult, a healthy adult coming to you to be proactive. I want to continue to feel good, focus on longevity. If you had a wish list of tests that you would like to run proactively to see, okay, well, you may be more susceptible than the next person for mold illness, for example. Is there a wish list?
I think just running a proper functional blood tests and looking at those markers is very important. Just doing annual blood testing could be impactful to see how well the body is optimally functioning. Right. So our range of functional range is very tight compared to what the conventional medicine says. And that could actually be helpful, number one. Number two is really pinpoint how the gut function is. I think talking about gut is very much more important than anything. I'll give you an example. I grew up in Korea and I moved here when I was 9 years old. But one of the things culturally in Korea, what Koreans do is that they ask their kids how their poop was on a daily basis. Was it solid? Was it watery?
Yeah.
Why? Because the poop quality talks a lot about how that kid is doing.
Mm,
And that's something that we should be comfortable talking about. How's your poop?
absolutely.
Right? Maybe that should be a greeting. How is your poop today?
There you go. That's on the
How's
wish
your poop
list.
today?
Yeah.
Yeah.
And then when you talk about kids who are malnourished, especially if they're picky eaters, then you need to have proper supplementation that is required. Right? If they're constantly eating Cheetos and constantly having to eat fast food, they might be fine right at this point in time, but the symptoms they're going to see, especially when you're dealing with stress, and then they're now going to a moldy dorm, and then having to get overexposure to chronic drug use could be happening, or it could be from use of moldy marijuana. Or
Mm.
if we're going to talk about that, there's a lot of mold issues going on in
Hidden
marijuana.
sources,
And,
yeah.
yeah, and that's the reason why when you try to buy a CBD, for instance, right, because mold can be embedded into the actual cannabis plant, you need to ask that particular company if they have done a mycotoxin testing. So the CBD that I recommend, I get their different batch of mycotoxin testing to ensure my clients that what I'm selling to them is clean. So I kind of went on a wayside, but that's how
No, I think that's
important that you
helpful.
have to look at the lifestyle aspect of it, what they're getting exposure on a daily basis in college. I know, for instance, when I went to my dorm in my second year, that place was moldy, not thinking about it, right? But we don't get to think about these things. We just say, oh, you know what? That's just a wet spot, right? We just have to bleach that area to clean it out,
Oh gosh.
which is the worst thing you could do.
Yeah.
But these are the common things that we have all of a misunderstanding of. And then when you're dealing with chronic issues of dealing with gut problem followed by autoimmune disease, right? Have to deal with onset of anxiety issues all around on top of skin rashes, right? All those things are related to some type of root cause issue. I think what happens with a lot of, especially college students, they don't get to wonder and question these things until they get into their probably late 20s or early 30s, and they start having some disposable income where they seek out help to work with a functional medicine provider and ordering these tests.
Sure. Yeah. I've seen parents bring in teens though, and they say, oh, we really, really just kind of discerning parents, concerned, kind of micromanaging. And make a good point, John, once you start looking, you're generally going to find something. And so how far do you want to take it if someone feels great? These are just all the complex things that we tend to think about as functional medicine providers. So I think we have some questions about, speaking of young people, fads and detox.
Yeah, John, I have to ask you about detoxification. I know you kind of talked a bit about your kind of process when you're starting the healing protocols for a patient. I know they're all going to be a little bit different. We talked a lot about cell membrane and mitochondrial dysfunction, but when it comes to detoxification, like what are some of these big red flags that you're seeing, especially in social media? It's like everyone's a detox expert now. We got celery juice, the medical medium protocols, heavy metal detox smoothie recipes going around. Like, is there any efficacy to anything out there? And I see you kind of laughing a bit, so I want to hear your thoughts.
No comment about medical medium.
I figured.
Listen, there are people saying drinking celery juice have helped them a lot. So if that is you, I have nothing against that. But to say that drinking green juice is going to be helping with cellular detox needs to support, that's an incorrect way to do that. And one of the key things I tell my clients is this: the overall 30 years of accumulation of toxins that you have in your body, you're not getting rid of that in 7 days.
Yeah.
Right. So that's just something that we have to understand. There's a reason why there's accumulation of toxins in the body, because you have poor mechanism of detoxing. But why? Well, there could be certainly, I mentioned about the whole fatty acid deficiency that goes on, and your cell membrane is not functioning very well. You have poor gut function. You're not able to detox very well. Your liver and your gallbladder can be impacted. And then fourth is your entire drainage pathway, maybe you're not sweating very well, right? If you have poor sweating and having to deal with constant body odor, for instance, I give you an example. I have patients who are not able to sweat very well, and then they smell very moldy in their body. Why? Because the detox pathway, and especially the drainage pathway, has not been an optimal function, so they can't function very well. So knowing that, giving celery juice or any type of green juice for that matter to help these so-called fat off detoxing, is that going to fix it? Absolutely not. So I don't recommend patients to follow those things. And the second thing, chelation therapy has been very popular within the early 2000s, and I know a lot of functional providers doing IV chelation, especially using EDTA calcium or DMSA. They are worth doing. However, they also damage the cell membrane as well. These having very powerful binding protocol, a property that end up having to embed into or binding into fatty acids. So you're causing more damage than anything, and then you're not really essentially looking at how the cell membranes function as well. So there's a whole topic that Dr. Robert Navio talks about. He's the author of Cell Danger Response, is that when you're looking at a person who's dealing with heavy onset of heavy metal, the reason that the body's not able to detox very well is because there's a dysfunctional state with the cell membrane, and the body's not able to get the actual metals out of the cells, which is where it is. It's not just in the blood itself. It's not just in the organs. It's in the cell in itself that we have to make those necessary changes. So it goes right back into how do we support the cellular detox? I mentioned about use of sodium butyrate, use of TUDCA, use of phospholipids, and as well as adding in the essential fatty acids is very important to support that process. And then if you want to use certain binders, and there are different binders, such as aloe could be a binder, right? Certain fibers can be a binder. It doesn't have to be charcoal. It doesn't have to be specifically fulvic acid for that matter, right? The fulvic acid is a great binder, but depending on what type of toxins you're dealing with, and as well as your walk of health, some patients cannot handle binders at all because the drainage pathway is not optimized. And if they're not having daily bowel movement, that still goes back to the entire drainage pathway, you're not a candidate to start using binders, because if you don't excrete that out, where's it going to go? Right back into your system.
My next question was really going to be like, how do you properly prep a patient to go through a detox like this? Like, are you focusing on, it sounds like digestion's a big one, sweating is a big one. Is it kind of opening up those detox pathways? Is that step one?
One, you want to prevent the exposure of what's causing the issue. So, I mentioned that we talked about mycotoxin early on. So you try to, sometimes it's very tough to do it because depending on the person's scenario and depends on where you're living and your income and what you could do at that point in time, getting out of a moldy situation could be very tough. But when you have an exposure to, let's just say, glyphosates, or having to deal with some certain pesticides, eating clean fruits and vegetables, or at least you could buy something locally, could be very beneficial in terms of reducing that overall burden right off the bat. So removing the exposure is number one. And then number two is really helping to optimize the drainage pathway. What does that mean? You need to look at how the person is sweating, how they're pooping, right? And as well as they end up having to do all the things properly, especially if they are constantly having to deal with the fact that they're not sweating well. And that could be a biggest impact. Then you need to optimize that pathway to allow them to sweat. If they're having poor digestion issues, right, and having constipation problem, that has to be fixed. And those are the key things I always ask. So in my symptom list sheet, the first thing I actually ask them is, are you pooping well? Number one. Number two is, do you feel satisfied after going to the bathroom? If they're not, then definitely there's a GI issue going on there. So we want to tackle that GI issue and then also support the digestive function, including a proper enzyme that has to be supplemented, as well as supporting the liver. When that's all done, then we can start adding in the fatty acids that the person is missing. and then start to work on the microbiome, because even just use of spore-based probiotic, that actually has an antifungal activity as well. Right? So you start to utilize these things to shift the microbiome in a proper way so the body's able to heal itself. As long as you give the right tools for the body will heal itself. The issue is that we do way too little or way too much, and not in a proper fashion or in an order that is able to allow the body to navigate on its own.
It's really like going back to that, quote that you mentioned in the intro earlier about how the doctor is you, the patient. And it's like we're just really giving the body everything it needs to function properly. And it's almost like everything will kind of take care of itself from there. But I really did not realize how complex mold exposure is, how the detoxification process can be, and just it's really not like a black and white scenario as with, all things in functional medicine. So thank you, Dr. Kim, so much for just sharing so much of your wealth of knowledge. And I really like to end all these episodes kind of on a positive note and ask each of our providers, what does it mean to you to live a vibrant life?
Yeah. So before I answer that, one thing that I like to at least promote is that there's a reason why I prefer going with the total tox burden testing from Vibrant Wellness compared to other testing companies. Your company end up having to really outline the entirety scope of mold toxins properly. So this way I know how to navigate the patients from start to finish. Whereas other companies, I'm not going to mention any names, the testing modality is not very sensitive enough that end up having to miss a lot of the pictures of what's happening in the body itself. So kudos to you guys for allowing practitioners like myself to use these modalities to help my patients. So that's one thing that I would like to at least congratulate your company and what you guys do and such.
Of course, we appreciate that.
And so how do I live a vibrant life? I think the vibrant life is all about your mindset of how you live your life on a daily basis, and how you navigate that is based on your choice of being happy or being miserable in your life. Everybody goes through misery. Everybody has a challenge. But if you can see the actual positivity of the experience you're going through, and that you're impacting people's lives based on your actions, and you're humbly able to accept that and learn each and every day to improve on yourself as well as to improving others' lives, I believe that that's the vibrant life to live in.
And it is a choice, being happy, it's a choice you make every day. And I always say, happy people are healthy people. It translates into your biology as well. So thanks for sharing that, John. And if anyone tuning in today wants to connect with you, maybe learn a little bit about mold, I know you mentioned you kind of have some webinars. Where can our listeners find you?
Yeah, absolutely. I have a website, drkimwellness.com. And as well as I'm very active on Instagram. My Instagram handle is dr.john, john.pharm.d, is PHARMD.
Awesome. I will be sure to link that down in the show notes for you guys so that you can locate Dr. Kim online. And Dr. Kim, thank you so much for taking the time to be on the podcast today. I can't wait for this episode to air. I'm definitely going to go back and re-listen because we had so many good pieces of information. And to everyone tuning in today, thank you so much. And until next week, wishing us all vibrant health and wellness.
Thank you.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guests and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.